Good morning to all and namaskar. I heartily welcome to all on our fourth day of International Faculty Development Program organized by Degree College of Physical Education Amravati and Shree Hanuman Vyayam Prasarak Mandal Indian Knowledge System Center in 43rd memory of Acharya Tryambak Guruji Joshi. It is my pleasure to introduce our international speaker, Dr. Indika Bulankulame, ma'am from Colombo, Sri Lanka, who has graciously accepted our invitation to join us today. Miss Indika practicing yoga for over 2 decades. In 2016, Miss Indika became a certified yoga instructor, passing out with the first class from the Bruhan Maharashtra Yoga Parishad Amravati, India. Since then, she has been practicing and teaching yoga. She specializes in individual and group classes, focusing on the balancing of mind and body for everyday living. Also, from 2018, she has been teaching yoga for the staff of Hayalis PLC in the tradition of Hatha Yoga. Miss Indika, also a sociologist, anthropologist, and visiting faculty of graduate studies at the University of Colombo, and currently the head of training and capacity building at the Center of Poverty Analysis in Colombo. Miss Indica is having a great career involvement and contribution to the betterment of the discipline, such as a lead instructor in International Day of Yoga, organized by the Indian High Commission in Sri Lanka. Also a speaker at the second International Conference for Yoga for Global Well-being in Dubai, as well as in 2019 and 2020, she was a judge in Yoga Asanas Championship. And in last, Miss Indika has been published two researches on Surya Namaskara and yoga for a healthy lifestyle. I'm glad to welcome you, ma'am. I request you to address us all. Thank you so much.
Thank you very much. Ayubowan, Namaskar. Good morning to you all. So before I get into my topic today, I would like to thank thank Dr. Sunil Labde for inviting me for this very interesting 5-day faculty development program of the Shree Vyayam Prasarak Mandal's Degree College. As the head of department, I'm very happy to be here, Dr. With Dr. Labde's invitation. And I also like to thank Dr. S.P. Deshapande, the principal of this college, for this great invitation. I also like to always acknowledge my guru, Dr. Arun Kodeskar. I believe he's here today. Thank you, sir, very much for all your encouragement, always. So my presentation today is on does yoga have an impact on the sympathetic and parasympathetic autonomic nervous system? So this is actually a work in progress. And I would like to mention that to kind of really understand how these two nervous system works, we need to understand a little anatomy. So in the first half of this delivery is about understanding that and seeing how the autonomic nervous system is placed in the body, what is what the significance of it, how it relates to our entire body movements, and then we talk about yoga and how yoga influences that, and some conclusions coming from it. So, so a little anatomy at the beginning. So we can start. I can go to the next slide. Next slide, please. Right. Thank you. So I have three objectives for this presentation. So the first one is this presentation attempts to understand the impact of yoga on our nervous system. Then the main objective of this presentation is to hypothesize if yoga only highlights or impacts the parasympathetic nervous system. So this is actually the core of the presentation, the core of this research that I have been trying to look at. And also, therefore, it looks at the impact of yoga on the sympathetic nervous system. So what actually is the impact on the sympathetic nervous system, the impact of yoga, and overall, how does yoga, asana, and pranayama affects the nervous system? So these are the three objectives in this presentation today. So let's go into the crux of the understanding how the parasympathetic and the sympathetic nervous system is placed in the body. So let's go to the next slide. Okay, so what is the nervous system? So the nervous system is built of two categories. One is the central nervous system. The central nervous system is composed of the brain and the spine. And then there's the peripheral nervous system, which is, these are two things. The peripheral nervous system consists of the nerves that branch from the brain and spinal cord. These nerves form the communication network between the central nervous system and the rest of the body. So these are very two separate things actually in the body, but they are communication, both have to communicate together to keep the body going. Next. Okay, so let's see where it is. So you see the central nervous system is in the brain and the spine. And if you look at the rest of the body, the peripheral nervous system is spread out in the body. It's from the brain itself, it's all over the body. Okay. Okay. So the peripheral nervous system has two parts. One is the sensory division and the motor division. So now let's see what is the sensory division. The sensory division is a thing that carries the messages to the brain. It's the afferent or the ascending, taking the messages from our external environment into our body, they're like signals, they're like pictures, they're giving you these receptors are taking messages to your body. How does it happen? Through the sensory organs. Now you all know, again, very important to yoga actually is the sensory organs. What are the sensory organs? We have 5 sensory organs. We have the eyes, the nose, the ears, the tongue, with the taste, and the skin, or the touch or the feel, right? So from these receptors, we take messages to the brain and to the brain. So there is a upward, ascending movement of the signals going in. Now, if you look at the motor division, it's the efferent or the descending division. So what happens is here the receptors are processed in your brain and through the central nervous system, and it goes into the muscles and the glands, right? And so it is like the descending process. So it's one is going up and the other is going down. But we need both of these two things to take the messages through. Okay, let's go to the next one. Okay. Okay, so now let's try to understand what are motor neurons. So this part is very important to us. The somatic, it's also divided into two categories, the somatic nervous system and the autonomic nervous system. And then I'll talk about the somatic nervous system in a bit. Then the autonomic nervous system breaks down to sympathetic nervous system and the parasympathetic nervous system. So let's just try to understand what is the somatic nervous system is. Okay, so the somatic nervous system is, first thing we have to understand, it's a voluntary movements. Like it's things that, like I'm speaking to you, my somatic nervous system is working, right? Because I am thinking and talking. It's not not like my heartbeat, which is beating and I don't know, it's involuntary, right? So the somatic nerve system consists of nerves that go to the skin and muscle, and it is involved in conscious activity from the skin and the muscles. The sensory receptors located throughout the body detect various stimuli, including touch, pain, temperature, pressure, and proprioception, awareness of the body, position, and movement. Sensory neurons, which are part of the somatic nervous system, transmit these sensory signals from the receptors to the central nervous system, especially to the brain and the spinal cord. The somatic nervous system is primarily responsible for controlling voluntary movements, as I said, of the body, such as walking, running, reaching, and grasping, and also some reflexive movements. If you're going to fall, this somatic nervous system is the thing that tells you, oh, you're going to fall. So they're all very voluntary. It enables us to interact with our environment, perform skilled movements, and carry out activities of our daily living based on conscious decisions and intentions that we make. So the decisions are very conscious. We are consciously doing yoga, consciously doing the activities that are involved in yoga. So now the second part is the autonomic nervous system. This works independently without a person's conscious effort. The autonomic nervous system is a visceral efferent system, which means it sends motor impulses to the visceral organs. So now let's see what are the visceral organs. They are the lungs, heart, organs of the digestive, excretory, and reproductive systems. So if functions automatically and continuously without conscious effort and helps smooth muscle, cardiac muscle, and gland functions. It is also concerned with things like heart rate, breathing rate, blood pressure, body temperature, and other visceral activities that work together to maintain homeostasis. It balances the autonomic nervous system. So the autonomic nervous system operates largely outside of conscious control and is divided into two main branches, that is the sympathetic nervous system and the parasympathetic nervous system. So you can see that so very clearly that this is involuntary, without conscious knowledge that is happening. What is very important is to have this balance, the homeostasis in our body. So let's see what is that. Okay, before that, let's see. So this is a entire picture of our nervous system that up to now we have talked about this. You can see central nervous system on your left side and the peripheral nervous system on this slide. And so we have come to the last two, which we will be discussing. I will not be discussing the central nervous system here because it's not relevant to the discussion that I'm making. But understand that both are interconnected in the way they receive the messages. Okay, okay. Homeostasis is many visceral organs are supplied with fibers from both divisions. In this case, one stimulates, the other inhibits. This antagonistic functional relationship serves as a balance to help them maintain homeostasis. Homeostasis is the process by which organisms maintain a stable internal environment despite changes in the external environment. So it's the external environment that affects our body, but this is the thing that keeps it going. Like you don't, you balance it, you don't overreact. And then inside your body, all the organs are brought to a stable condition in the event of something drastic happening in the environment, or even simple things like temperature changes affects the body. So that is also regulated by this homeostasis. It is crucial for the proper functioning and survival of living organisms. Homeostasis involves the regulation of various physiological variables such as temperature, pH, the blood pressure, blood glucose levels, and electrobalance within narrow limits, and ensuring that cells and tissues can function optimally. So this is a very important aspect of the balancing of the body. Okay, so you can see in the next picture, you can see it balances, and then we have the two the sympathetic and the parasympathetic, creating the differences, and then you balance it. Okay, next. Okay, now let's see the functions of the sympathetic and parasympathetic nervous systems. Okay, so we need to figure out where these two things are in our body, right? So the sympathetic nervous system is part of the autonomic nervous system, as I said before. It is located near the thoracic and lumbar regions of the spinal cord, whereas the parasympathetic, it is located in between the spinal cord and the medulla, that is in the brain. The sympathetic nervous system prepares the body for the fight or flight response during any potential danger. And in the parasympathetic nervous system inhibits the body from overworking and restores the body to a calm and composed state. So let's look at in the next diagram where they are actually. Okay, so we can see that on your left side of the screen, the sympathetic nerves are between these thoracic nerves and the lumbar region, but they are not attached to the spine. They are attached in receptors, right? And because remember I said central nervous system consists of the brain and the spine, and here on the spine, on the side, with receptors, these sympathetic nerves are there. The parasympathetic nerves are in two parts. It is between, on your extreme right, you can see the brain, this medulla, and between the medulla and the spine. There are some parasympathetic nerves, and also at the in the sexual glands, also these parasympathetic nerves are there. So it's both these parts. Okay, so now let's see what organs are affect what nervous systems. So if you look at the parasympathetic, we have the pupil construction. It stimulates saliva, contracts the bronchi. So slow heart rate, maintains slow heart rate, stimulates production of bile, stimulates digestion, internal muscle relaxation, and also affects the sexual glands. Then the sympathetic nerve dilates the pupils, inhibits salivation, relaxes bronchi, increased heart rate, slows down digestion, stimulates glucose release, reduces intestinal muscles, adrenaline production, and also has a direct impact on the sexual glands. Oh, so these are the two. You can see how important these two nervous systems, how they are directly related to your body functions, and let's see how they react to each other. So you can go to the next one. So we do know that the parasympathetic nervous system is influenced by yoga. That is something that we talk about. We know that the parasympathetic nervous system has a direct influence when you're doing yoga. But let's just look at the literature on it. I'm just presenting one case study here. So in a study conducted by Shobana et al., they look at the effects of long-term yoga training on the autonomic function among healthy adults. This cross-sectional comparative study was conducted among 68 healthy volunteers of both sexes in the age group of 17 and 30 years. Regular yoga practicing volunteers were selected for this study. Healthy participants who do not practice yoga and also any physical activities were selected as a control group. So from the study results of this shows that the resting heart rate and the hand grip test as a test to test this parameters were significantly lower in the participants participating and practicing yoga compared to the control group participants. And the results were consistent with previous findings. They say the changes in yoga practitioners may be because of the domination of the parasympathetic nervous system over the systematic system. What they say is from this article is that because of the influence of yoga on the parasympathetic nerve, the sympathetic the effects of the sympathetic nervous system is comparatively less. So there's greater functioning of the parasympathetic nervous system. Okay. Okay, now let's see what is the literature on the sympathetic nervous system. So I'm presenting two case studies here. One is done by Shree, a study looking at the effect of yogic intervention on the autonomic nervous system in the patients with coronary artery disease. It's a randomized controlled trial. The objective of this study was to determine the effects of yogic practices on the sympathetic blood pressure response to lying to standing test and hand grip test. That's the test that they have used. And the parasympathetic functioning on the parasympathetic nerve of patients with coronary artery disease. 250 patients were selected and was randomly assigned to one of two groups. So the study group was with medication plus yoga, and the control group did not have any yoga but only medication. So this is done through the Department of Cardiology in Chhatrapati Shahuji Maharaja Medical University in Lucknow. The study was conducted over 18 months. It looked at high blood pressure as a major cause of cardiovascular disease, and primary hypertension is a frequent pathological condition of cardiovascular disease. So these are the things that they looked as parameters to come to this decision, or to look at as findings of their research. In this study, BMI, waist to hip ratio, SPP, DPP, and resting heart rate decreased significantly more than the intervention group, that is the study group, than in the control group. So the group that got yoga did better when it came to coronary artery disease. And so that is the, can you go back to that slide? Yes. So that is the sympathetic nerve is the one that they were trying to look at, because sympathetic nerve, as we will learn in a little bit, is the one that aggravates with stress some of these cardiovascular diseases. So the next example I bring into this presentation is a study done by Rika Kimoto et al. These effects of yoga on the autonomic nervous system functions in females. So this is like looking at adult females. And the purpose of this study was designed to assess the effects of yoga practice sessions on the autonomic nervous system functions, and focus on the relationship between ANS function and subject age or personal history of yoga. Here, a total of 113 healthy females participated in this study. They attended a 120-minute yoga practice session conducted by well-qualified instructors. The autonomic nervous system function was assessed before and after the yoga practice session by HRV power spectral analysis. As a result, in females, yoga reduced fatigue by primarily improving the systematic activity. So as I said before, this sample is this sample consists of adult women who were in menopausal age. So the fatigue is also part of menopausal women. The practice of yoga directly affected these symptoms and it invigorated the sympathetic nerve and balanced out, because it reduced the symptoms of menopause, like hot flushes and night sweats, etc. Okay, so these are two examples I bring in to understand the effects on yoga on the sympathetic nervous system. So I wish to say here that the sympathetic nervous system, can you go to the next slide? Yeah, can you go back to the other one? Could you actually go a few few back. I just want to go back to some more. Some more. Yeah, just keep, no, go back. Go one more back. Just to the table. Yeah, just keep it here. So I said that the sympathetic nervous system prepares the body to fight or flight response during any potential danger. And it's an important nervous system because it is the one thing that protects us from danger. Whereas it is also the nervous system that creates the adrenaline, and adrenaline is needed to if you're in a potential you're exposed to danger, that is the one that keeps you from getting into danger. And also it is also the one that gives you the message to say, go away from here because there's danger. And so in fact the sympathetic nervous system is very important in that respect. Although the sympathetic nervous system also needs to be controlled because all the stressors are also on the sympathetic nervous system. So as you saw from the example, the cardiovascular diseases, everything comes because of stress, and that imparts on the sympathetic nervous system, right? Whereas the parasympathetic nervous system is mostly for rest and digestion, and it is the one thing that is soft and peaceful and makes you calm and brings the body into a very nice state. So I would say that both of these nervous systems are needed for the functioning of our body. Okay, so now we go back to the slide that we, yes, here. Right. So what asanas are beneficial for the sympathetic nervous system? So first we want to look at the sympathetic nervous system. So I talked about 3 asanas, the Bhujanga, Adho Mukha, and Sarvangasana. These asanas stimulate the sympathetic nervous system, heart rate balancing cardio health, energize greater health, flexibility, and strength. It develops strength, endurance, controls blood pressure, heart rate, body temperature. Now, before I go individually to explain the 3 asanas, I would like to bring your attention to the fact that, remember, I said that the sympathetic nerve lies on parallelly to the spine with their receptors. So all these 3 asanas are very much involve the spine area, and so it's very directly connected and related to the sympathetic nervous system. Okay, so next slide, we'll start with Bhujangasana. Bhujangasana. Now look at the Bhujangasana. If you look at the study by Ernest, found that in subjects who adapted the Bhujangasana, the production of steroid hormones was controlled by neural mechanisms, contributed to good blood circulation, which is the key to staying energized and active. So one of the main benefits of Bhujangasana is that it helps to improve blood circulation. Once you have good blood circulation, your body cells will get enough nutrients and oxygen. So you're stimulating your sympathetic nerve by doing Bhujangasana. That is why you get a lot of energy when you do it. Improved blood circulation will also maintain hormonal balance. The direct this is directly connected to the sympathetic nervous system. Okay, let us see the next asana. Can we go to the next slide? Yes, the Adho Mukha Asana, or the downward dog pose. In this asana, one is inverted into a V shape, which means your heart is above your head. This will improve blood flow to your head. This will enhance your focus and energy. Regular yoga practice may reduce levels of stress and body-wide inflammation, contributing to healthier hearts. Several of the factors contributing to heart disease, including high blood pressure and excess weight, can be addressed through yoga. So you can see that the Adho Mukha definitely has a very close impact with the sympathetic nerve, and it stimulates it when you're doing it. And if your stress levels are going down, you are actually stimulating your sympathetic nerves. I'm not saying it doesn't have anything it doesn't do anything for the parasympathetic nerve. It does, but what I'm saying is it also directly relates to the sympathetic nerve. It improves flexibility and develops endurance, which is needed for the optimum functions of the sympathetic nervous system. Okay. Next asana, the Sharvangasana, shoulder stand. As the stagnant blood from the lower parts of the body is drained to other body parts, the blood supply to the brain and hormonal glands increases. All the functions of the endocrine system, hormonal system of the body are improved due to an increase in oxygen and blood supply to them. The effects of the Sharvanga asana is immediate and leaves both the sympathetic and the parasympathetic nerves in good state of health. That is why we always, when we do the Sharvanga asana, we come back feeling very good, because it stimulates both actually, and it gives the required blood flow to your brain, and it stimulates your thyroid, and it's an overall very good asana, as we all know, and it particularly has a big impact on the sympathetic and the parasympathetic nerves. Okay, so now let us see what does the next slide. Yes, what does the parasympathetic nerve do to when we are doing pranayama? So pranayama, and also I should say meditation here. So the parasympathetic nervous system is invigorated through the practice of pranayama, because it's a nervous system which is in a calm state. So you are actually giving it another dose to kind of really accelerate, or to make it perform, to give it its optimum performance when you're doing pranayamas and then you're doing meditation. Additionally, when practicing yoga, a fundamental emphasis is placed on accepting one's moment-to-moment experience, creating mindfulness and not forcing the body past its comfortable limits. The parasympathetic nervous system is brought into balance when you're doing pranayama and meditation both. So meditation is the level that takes the pranayama to a greater level, which is so important in yoga, and it's the ultimate destination in yoga. And so balancing this pranayama with the parasympathetic nerve with the pranayama will also have a double effect on your sympathetic nervous system. Okay, so we can go to the next slide. So the benefits of pranayama is to calm the sympathetic nerve and invigorates the parasympathetic nerve. So you can see when this gets stimulated, sympathetic nerves get calmed, but calm to the point where it balances your hormones, your adrenaline, your clarity becomes better. Your clarity. It strengthens the mind, brings attention to the breath, develops the intake of the capacity of air, releases tension, improves digestion, removes excess heat from the body. See how it relates to the sympathetic nervous system. Synchronize the mind and the body together, prevents and delays non-communicable diseases, and releases overall good hormones. Okay, so we are almost coming to the end now. Before we come to the conclusions, I just want to go back to just do some little revision back. So we know that the nervous system has two parts: the central nervous system, that is the brain and the spine, and then we have the peripheral nervous system. And from the peripheral nervous system, there are two areas: the motor nerves and the sensory nerves. So the sensory nerves are the things that we, from the outside environment, we take messages to the brain, and the motor nerves takes the messages from the brain to our muscles and to our bones. So the motor nerves, again, have comes into two things: the somatic nervous system and the autonomic nervous system. The somatic nervous system is the one that voluntarily controls all our movements, whereas the autonomic nervous system is involuntary. We breathe, our heartbeat is beating, and various things in our body is happening without our conscious knowledge. And then we break that down to two most important things that we discussed in this presentation: is the parasympathetic nervous system and the sympathetic nervous system. So the parasympathetic nervous system is placed within the spine and the medulla, and part of the lower body in the reproductive organs, whereas the sympathetic nervous system is placed between the thoracic and the lower limb along the spine. So you can see how important these two nervous systems in our body, and actually to be conscious of these nervous systems are also very important. And yoga is important to both these nervous systems. But yoga is important to the parasympathetic nervous system, but is equally important as the sympathetic nervous system. Yoga enhances the sustenance of both these nervous systems. It brings the best output of these important nerves. It helps the secretion of good hormones. That's the main thing, because our body is balanced by hormones, which are so crucial and very important for yoga. And it optimizes the autonomic nervous system, provides for a good and happy life. So this is a work in progress, and I'll be happy to answer questions and any other comments. And can go to the next slide. And I could go to the next slide, please. And also to the next slide, these are some references that I did for this research. And the next slide. Thank you very much all once again. Especially like to take this opportunity to thank the HVPM's Degree College of Education for inviting me for this presentation, and for this important faculty development research symposium. Thank you all. Thank you.
Yeah, thank you so much, ma'am. Before we go to an end, There is one participant who is having a question. The question is Kapalbhati and Agnisar has effect on sympathetic nerve or parasympathetic nerve. And can you explain about this?
Okay. Yes. Uh, Kapalabhati, which actually is focused on our skull here, and so you would think that it definitely has an impact on the parasympathetic nerve, because parasympathetic nerve is actually inside your brain, whereas the sympathetic nerve is outside of that. And yeah, and both the other one as well. And yes, but it is not to say that they do not affect the sympathetic nerve, because when you're doing Kapalabhati, you are using your body as well, and because of the forceful breathing. So it does affect on the sympathetic nerve as well. So most of these things, I would say, is complementary. Like both one, you do one and the other is also stimulated. It's not in isolation that these two nervous systems react, because in when you're doing yoga, you can't only do yoga for one, because it definitely affects the other one. So I should say both gets stimulated when you're uh, doing yoga or pranayamas.
Okay, there is another question. Can you suggest any yogic techniques for psychiatric problems like schizophrenia?
Krishna. Yeah, okay. So I wouldn't, to be very frank, I wouldn't know exactly what kind of yoga technique will be exactly look, because this is a specific psychological or psychiatric problem. So, but I would suggest that all pranayamas will have a good calming effect on the parasympathetic nerve, and and that will you know give some relief to someone who has the symptoms. But it's a very specific and individual disease, so it has to be, one-on-one treatment has to. So there is no one fit model that you can give someone who has a mental disease.
Yeah, I think
I think,
uh,
yeah.
there are no more questions. Yes. Yeah, it was really, really, really informative and really knowledgeable. I think nowadays it is really important because due to a lot of stress, it affects directly on our parasympathetic and sympathetic nervous systems. So it was really, really knowledgeable, ma'am. As you explained the impact of these nervous systems, their functions, the importance of this on our body, uh, and um, like how it affects on our body and our organ. So really, thank
I
you so
think,
much.
yeah, and I'd like to say that we need to do more research on this,
Yes,
and
yes,
uh, and because I think one of the challenges we have is that how do you prove these things? You do know yoga as a, you are a practitioner, we are academics, and that these things, you know it comes from the sutras, and but how do you connect that in the modern world? Like, how do you explain this is good for your body, and this is, yoga will, give you so much. You can, deal with your medical problems to a certain extent. So no one is saying give up your medical medicines, but what you're saying is to complement it with yoga, so that your treatment becomes better, and your recovery becomes faster if you're sick. And if you're not sick, then obviously yoga is a very good way to kind of deal with that, deal and to have a better life. Lots of studies on cardiovascular diseases have been done in other countries like Western countries. Medical doctors have now taken uh, uh, cardio. Taking yoga as especially to stimulate these parasympathetic and sympathetic nerves. So I think the we do need to do more research on. That's my take on it. That on the various aspects of yoga, how they uh, contribute to the development of your body.
Yes, yes. I think also with the help of our regular practice on meditation, also with the help of pranayam, I think we can prevent all the stress with the help of this. I think so. So, really, once again, thank you so much, ma'am. I would like to to extend my heartfelt gratitude to our esteemed guest, Dr. Indika Bulankulame, ma'am, from who join us from Colombo, Sri Lanka, who present here and address us on really important topic. And also, I would like to thank all of you who present here for making the time to be with us today and helping us make this event success. Thank you, one and all. Thank you so much. Namaskar.
Namaskar. Thank you.